Okay, and welcome to this lecture on evidence-based practice. For today's readings, you should have completed the Mullen, Bledsoe, and Blemmy article, Implementing Evidence-Based Practice in Social Work. That is going to be kind of the focus of the lecture today. So the basic premises of professional social work practice is this commitment to the client's best interest, to be responsive to our client's needs, to have ethical practice, to be guided by our values and our ethics, to have clear goals and outcomes, to be accountable, and to certainly be committed to scientific standards of evidence and be guided by kind of that knowledge that's been tested and evaluated. So that really connects with this idea of evidence-based practice. And that's what we're going to spend a little bit of time talking about today. What is evidence-based practice and what does it look like? So some of the definitions that have kind of been published out there, this has become certainly a more recent topic, talking about evidence-based practice, probably starting in the late 90s, early 2000s, really being pulled in, starting in medicine and now being pulled into many professions. Kind of our practice is really being guided by evidence. So this idea of the current evidence or current practices are the reasons why we're making the decisions that we're making in terms of the care for the individual patients that we see. So you're trying to combine the best research out there with our clinical experience and our patient values. So that's kind of this idea of integrating all of them together. And certainly that that we want to know what the findings or the literature is showing us, what interventions are beneficial and will produce effective results, and then practicing that and integrating that into our work. So why does it matter that we kind of do evidence-based practice? This idea of what's the purpose of it? I think a lot of times social work is kind of seen as a practice that is kind of use our gut, we kind of use our instinct, kind of that. We don't have tools that we're using necessarily in with our clients. So we're not like a physician that's able to take blood tests to say, okay, you're diabetic or you have depression. So, we're using kind of experience or expertise and kind of what the client is kind of giving us or what the individual is giving us in terms of material. And so when we think about the social sciences and research and hard sciences and research, oftentimes there's kind of seen as a difference. And I think what we're wanting to do is have more of be kind of better recognized in terms of our practice that way, and what people see is that we're not just kind of guessing at this, we're applying research and knowledge and experience and expertise and client values to make the decisions that we're making. So, so that's what it kind of looks like. How can we apply it? Certainly kind of knowing what it is and what it looks like and how to do it is something to consider. How reasonable is it expect that we are able to apply it? It's challenging. And I think, when you're out there in the field and you have a caseload of 20 plus clients that you're seeing, and this idea of integrating having research guide each kind of patient contact that you're having is quite a pressure on. So I think that's why it's important that we think about collaboration, we think about working in groups, and think about working with others. So peer supervision is something that we'll talk about or we probably have talked about in other classes, or we'll talk about in other classes. This idea that we support each other. And so if I'm working in an agency where myself and another colleague are really being challenged by a client who perhaps is cutting, then maybe we work together and do some research and find out what the best evidence and what the best kind of practice is for helping kind of that population that we're seeing, and what's the best practice for that. And by us working together, is that maybe I'm finding some of the research, and then we're going through that together and kind of brainstorming on how we could integrate some of those best practices into our work with those individual clients. And maybe on the counter side, that coworker of mine might have another client that we're dealing with in the future, and that individual will do more of the heavy lifting in terms of the research piece of it. So that's kind of what it looks like. And in terms of who's kind of how this is working or who's responsible for this, I think more and more we're seeing our practice is being it's almost being pushed this way. If you're out there and you're being funded, more and more kind of funding sources are requiring us to have evidence as to why we're doing what we're doing. They want measurable goals, they want measurable outcomes, and they want measurable reasons why we're doing treatment of what we're doing. And so I think we're going to see more and more of this out there. This originated in medicine. I actually recall a coworker of mine when I first started in social work kind of being pulled out of our agency and actually being recruited by the medical school. And the idea was that they were finding that they needed evidence to kind of guide their practice in terms of they were finding a lot of their physicians didn't have bedside manners, and so they were kind of trying to set up a group of kind of people to train, and this would happen to be several social workers, to train the physicians in terms of kind of improving their connection with clients, their engagement with clients, kind of skills that we have as social workers. And so she was being trained to kind of do this, and the idea was that there is evidence, they were gathering evidence to kind of support this, that physicians that have kind of better bedside manner and can connect to their clients are often do better, resulting in less lawsuits and things like that. So anyway, that's what I kind of experienced, what I saw. But aside from that, we know that medicine has kind of been going this way for a while. Insurance companies want to reimburse tests or treatments that work. So there's more and more research for a specific cancer drug, and that's what they're going to kind of want to see physicians doing in terms of treatment that way. So it's certainly a way of protecting or practicing social work, is this idea of assessment, intervention, evaluation. We need to gather knowledge from the research and theories, integrating kind of our expertise and our values, but also that kind of research or scientific knowledge. And certainly reflecting on kind of the ideologies, values, kind of awareness of the influence of our own views on kind of what we expect to see and how we see it and how we think and how we react to others. So we're kind of still pulling in that personal piece, we're still pulling in that patient value and patient needs piece, but thinking about kind of the research end. And then certainly continuing to evaluate our practice to see what's kind of working and what's not. So the idea of evidence-based practice is, and this is noted in your textbook, is, sorry, I have the page, or not in the textbook, on the article that I just noted on page 327. So this idea is really simple. If you think about kind of your science classes back in the day, in elementary school, is this idea of, okay, pose an answerable question based on a client need. So, we had this young girl who's cutting, and we need to kind of know how to best treat her. So search for best evidence to answer that question. And what is the research kind of pointing to in terms of treatments, in terms of support, in terms of needs, in terms of what we should kind of do. Assess the information based on kind of how it connects to her, how valid is this, how applicable is it to this client situation. And then we're going to integrate the information about this client. So her situation, maybe how old she is, maybe some of the strengths, maybe my expertise in terms of working with this population, what she values. So what are some of the suggested practices that are out there? And then certainly trying them with the client, trying to see how that works. And then evaluating how well that kind of treatment or intervention worked, and see how I can maybe alter it for future practice. And then certainly sharing that with colleagues that way and saying, hey, this is what I found to be really helpful, this is what works kind of in this group or with this population. So certainly, what do we need to do? Identifying knowledge and gaps in information, and certainly the needs. We need to value the role of kind of research in kind of guiding our selection and application of different interventions. We need to certainly develop skills to locate, evaluate, and apply this knowledge. And that's really the start of this class. If you think about the finding scholarly journal articles through the library databases, if you think about how to, another class is focused on searching the internet and finding sources kind of on the internet. And another source is also the readings, so to speak, are the Campbell collaboration and the Cochrane collaboration as kind of databases that host kind of recent publications about a specific topic. And so certainly kind of knowing how to find those resources, and certainly, we've talked about this several times, and you'll see this in your annotated bibliography and several of your other assignments, it's not just finding the information, but it's also evaluating it. So reading it, clearly assessing some of those articles and finding, okay, what is applicable to my client, what is applicable to my agency that day. And then certainly considering our professional judgment and practice wisdom and knowledge that we have. And then certainly the needs and values of the client are included in there. And then we just kind of continue practicing all of that. So that's a little bit about kind of evidence-based practice. It's a term I want you to kind of know as you're moving forward. You'll see this in your additional classes. You'll see in your, if you're not already in methods classes, but you'll see in your methods classes this idea of really integrating research into all of your papers. So you're going out there and you're finding articles that are related to the papers that you're writing, and you're connecting them to your practice. So we're trying to train you at this point to know that the decisions that you're making and the activities that you're doing out there with your clients need to be kind of guided by something. Part of that is experience, but part of that is research that way. And part of that is kind of the client values and what they're bringing in. So you're integrating all three of these together to provide the best practice and the best service for your client. And then you're certainly evaluating that each time and seeing what kind of is working or not working with that client. All right, that kind of wraps up this lecture. This goes on to talk about some of the references, and this PowerPoint is also located in Blackboard. Thank you.